For more than a century, cryosurgery has been known as a treatment modality for various skin disorders. The treatment units of the CryoPro series, which are based on liquid nitrogen, represent modern cryosurgery in its most advanced form. Today, cryosurgery offers highly efficient and rapid treatment at low cost. It is associated with no or minimal pain and shows excellent cosmetic results. Cryosurgery is the deliberate and controlled destruction of diseased tissue by cold. As tissue is rapidly supercooled, intracellular ice formation occur, leading to rupture of the cell membranes and consequently cell destruction. As you know, water expands during freezing. Similarly, recrystallization by slow thaw is responsible for even further tissue destruction. Accordingly, quick freeze, a slow thaw is the mantra of cryosurgery. Although nitrous oxide and carbon dioxide have been used in the past, liquid nitrogen is by far the most effective and popular coolant today. Liquid nitrogen is non-toxic and environmentally friendly, and with a temperature of -196 degrees Celsius, it delivers superior efficiency. In addition, liquid nitrogen is inexpensive and readily available. The CryoPro is available in two sizes, the Mini holding 0.35 of a litre and the Maxi holding half a litre. Apart from liquid nitrogen capacity, the two units are identical. The CryoPro unit consists of a super insulated stainless steel thermos bottle equipped with a special liquid releasing valve system. The valve is operated by a trigger which may easily be adjusted to right or left hand operation. Further, a pressure controlling relief valve maintains a constant operating pressure. This feature may be associated with a weak hissing sound, which is normal. A spray tube features quick attachment of different spray apertures and contact probes. Liquid nitrogen is stored in highly insulated, non-pressurized containers with minimal natural evaporation. Such containers, so-called dewars, usually hold 20 to 35 litres of liquid nitrogen, typically enough for 2 to 4 months of use. On a daily basis, easy handling of liquid nitrogen is essential, and to fill the CryoPro unit, a withdrawal device is strongly recommended. It features an adjustable handle to adjust the internal tube length to the actual container. The withdrawal device, offered by Cortex Technology, serves the purpose of filling the CryoPro easily in a safe and quick manner, and the soft rubber ensures that the handle seals when pressed firmly against the neck of the container. The withdrawal device is designed to fit a majority of containers available on the market today. It also provides a filter which will prevent impurities and ice crystals from getting into the CryoPro unit. The filling process immediately stops when the handle is lifted off the container. When the CryoPro is filled, screw on the top. The unit will be up to full operating pressure in a couple of minutes. Two methods are available: spray freezing and contact freezing. In spray freezing, there is no direct skin contact. The method makes use of the coolant in its liquid state. Therefore, the spray distance needs to be short, as the liquid nitrogen starts evaporizing as soon as it leaves the spray tip. A distance of approximately 5 mm is ideal, as it also provides the most precise spray. As standard, a CryoPro unit comes with a set of 6 spray tips covering a majority of applications. The apertures vary in size from A through D, D putting out the smallest amount of fluid. Simply choose a size which will freeze the lesion as quickly as possible, at the same time offering good control over the spray and the minimal damage to healthy skin surrounding the lesion. Spray freezing offers quick and efficient freezing with minimal preparation of the site to be treated and no cleaning of the tip, as there is no skin contact. Attention to the lateral spreading is necessary. For contact freezing, a range of so-called contact probes is available, from sharp-pointed to 3 cm in diameter. All contact probes are equipped with a silicone tube directing the exhaust gas away from the patient. This method makes use of a supercooled metal tip which is pressed against the lesion. Select a probe with a tip diameter fitting the size of the lesion. Moisturize the treatment site with a drop of gel or a cotton bud soaked in water. Then apply the probe while it is still warm without pulling the trigger. With the probe in place, pull the trigger. After a few seconds, the probe adheres to the skin, ensuring optimal skin contact and heat transfer. Keep freezing until a 1 mm frozen halo is seen around the probe. Then release the trigger and the probe will come off in a few seconds. This method ensures the quick freeze, slow thaw, leading to optimal tissue destruction. Contact freezing offers a deep freeze with minimal lateral spreading. The freezing time depends on the type of lesion as well as the operator's personal preferences. But 10 to 15 seconds of continuous freezing covers a broad spectrum of applications. Guidelines regarding freezing times and choice of spray or contact freezing can be found in the enclosed manual or in relevant literature. The probe is in direct skin contact and autoclaving at 121 degrees Celsius for 15 minutes is recommended. Over time, an increasing concentration of ice crystals may be noticed in the container. Also, particles are worn off the cork when removed and reinserted into the container. We advise to clean the container 1 or 2 times per year prior to refilling. Take the container outside and make sure to empty it completely. Then dry out any remaining water. For this, a vacuum cleaner can be used to create strong air ventilation for 20 to 30 minutes. The container is now clean and ready to be refilled. Withdrawal devices are equipped with a filter. A clogged filter on the withdrawal device needs to be replaced. Simply unscrew and replace. A clogged spray aperture can usually be cleaned easily. Unscrew the aperture, initially clean the spray tube and then blow the tip clean in the reverse direction with liquid nitrogen by holding it firmly against the spray tube. Pay attention, escaping nitrogen may cause frostbite. Liquid nitrogen remaining in the CryoPro unit after a day of work may just be left in the unit. It will evaporate by itself. Alternatively, it may also be poured back into the container. If so, the top should be put back in place. Otherwise, condensing air from the environment will form ice crystals in the treatment unit and eventually lead to clogging of the main valve. A full container is heavy and should be handled carefully to prevent spillage. A roller base trolley facilitates handling and protects the container. Make sure that the full container is stored in a ventilated room and out of reach of small children.